So then I want to come over and I want to grab my bleeding control stuff, apply direct pressure on that, and then bandage that. And notice I've got the roller side up, so it's a little bit easier to control. And we'll go a little above, a little below. We pull it nice and tight so that it creates a pressure bandage. Around, and then I take a look at the effectiveness. If that is just pouring through, then I need to go more aggressive. And I can take the tourniquet, open that up, position myself off to the side so that this way I'm pulling the tourniquet towards me. Get this over the arm. I'm going to go just above that closest joint, or I can go all the way up and go high or die. So I'm going to get this on. We're going to pull that as tight as we can get it. Undo that, and then I'm going to twist 2-3 times. Walk that in, check and see if my bleeding has stopped. If it has, then I'm going to bring this in. Run that over, and then we can mark the time if we needed to. So now the bleeding is stopped, so now I'll go back and start with my airway. In order to do the airway, we're going to unbuckle here, and then I'm going to reach in, grab the head. Ty's going to remove the helmet. Okay, he's going to take that over. So now we're going to go and check the airway. So I'm going to come in, you can back up just a little bit, and I'm going to open up the airway, and I'm going to look, listen, and feel, and I'm going to try and get a respiratory rate, rhythm, and quality. That's when we discovered it was about 4 breaths per minute and shallow. So go ahead and take over. Get some of it out of the way. I'm going to grab some airway stuff. Right, so measure, corner, corner, that's the right one. So from here, I'm going to grab, rotate, and he accepts. Then we'll take the nasal, lube that up, bevel towards the septum. Great, and because he was only breathing 4 times per minute, BDM, and put that on. You're going to go ahead and bag that patient. We're going to do that 1 every 5, and then I'm going to get some oxygen out. So he's bagging in the immediate so we can get that going. Turn the oxygen on, get that hooked up, turn it on to 15 liters. Now we're bagging with high flow oxygen at 15 liters per minute at a rate of 1 breath every 5 seconds. So now his airway is open and secured. We're doing the breathing at the proper rate of 12 to 20 breaths per minute. Now we can finish out by checking my pulse. Check the pulse on this side because I shouldn't have one on that side. And now I'm going to get rate, rhythm, and quality. This is when we come up with 120 rapid and weak. So air breathing, circulation, real quick check to see if there's any other severe bleeding going on, which it does not look like it. And then as far as exposed, I am going to need to get this off him so I can at least check the chest, see if we're all intact there, if there's any holes bubbling, anything at all like that, JD, tracheal mediation, all going with that. So right now I've exposed what I need to expose, and I'm going to leave this undone so we can get ready to move him. Right now, I've got enough information to pretty much say that this is a high priority patient, needs immediate transport, right? So he's going to keep bagging. What I'm going to do now is a quick head to toe assessment for any other life threats, right? So I'm taking a look for decap BTLS. I've got to check the posterior of the neck for any step-offs. Take a look at the neck right here. Going to come in, quickly check this shoulder and clavicle, push them together. Push down on the chest. I'm going to hold my hands in, and as he gives a bag, I make sure that the chest expands out equally on both sides, which it does. While I'm here, I'll take the stethoscope out. And I'm going to listen while he's bagging, and I want to see if I've got inflation on all sides. Right? I got air exchange going in. Top sounds good. Bottom sounding good. don't hyperventilate, because that's not good for his head injury. All right, so lung sounds are clear. I finish coming down the chest. I'm going to reach in underneath the back as far as I can go. Expose the abdomen. I'm going to push in. One hand on top of the other. See if there's any reaction. Push in on the hips. I'm not going to expose the legs yet because we're outside, but I'm going to run down and see if I feel anything at all. Which I don't on this side here. Can you wiggle? Can you push? Can you pull? Check for pulses if I've got footwear removed. If I don't, I'm not going to worry about that yet. And then I'm going to come over on this side. Same thing. Slide down. Can you push? Can you pull? Can you wiggle? Got no response going on. This arm closest to me now. All the way down. Can you squeeze my hand? Can you wiggle? Okay. See if there's still a pulse. Yes. And then I'm going to check this side here. We still have that. Bleeding is still controlled. Can you wiggle your hands? Can you squeeze? No. All right, so real quick assessment, didn't find anything else. So now I can come over and I can put a collar on him before we actually move him. So, and with this here, this is going to pose a little bit of a problem for that collar. So what I want you to do is to stop bagging for a second. Let's get this up over his head. Okay, perfect. Start bagging again. Now we'll worry about getting this collar in. We had measured it, and I haven't moved it, but if we did it, we'd come off from the chin down to here. It's actually 2 fingers, which is this last space. Lock that in, and then we can slide this in place. Bring it to the other side. I want to go plastic to plastic, which I've got. His chin, watch your fingers, should come right out to the end, and it should be midline, which is good. My injury is on this side, so I need to roll him up on that side. So we're going to bring the board in on this side here. Let's get these out of the way. And when I do this, watch me, I'm going to start up a little bit high. Okay? So now I can come over on this side here. Arm is going to go down. This arm is going to go here on your count. 1, 2, 3. It's going to come up. That's going to come out of the way. This is going to come over. It's going to come up. On your count again. 1, 2, 3. It's going to come back down, and then we're going to slide up into the middle on your count. 1, 2, 3. Okay, back to bagging, please. Make sure the rest of him is centered. We only want 3 straps. Nipples, navel, knees. Right? All I want to do is make sure he doesn't fall off this thing. That's it. This is going to be smart. This. And this is not too high. Here. There. You don't have to worry about anything on the head. He's at the head. He's still holding manual stabilization while he's bagging. So now we can take this, place that there. This stuff out of the way. If you want to cover with a blanket right now, we can do that for shock. And then we're going to get ready to move him onto the stretcher. So the stretcher out where we can actually work on it. Okay, so you can set that on his chest. On the count of 3, we're going to lift. All right, your count. 1, 2, 3. Over. 1, 2, 3. Down. Start bagging again. These on. These are, and actually hang on, before we do put these on, what we're going to do right now is that we've got him moved. We're going to undo these because that board is for extrication only. You should not be staying on this board. Okay. So we'll unclip one side. Arm up here. And what we're going to do now is I'm going to pull him to the side just slightly, and I'm going to tilt him. You're going to grab the head, put the BDM down, and on 3 we're going to take him off. Ready? 1, 2, 3. Okay. Slide him off. Bring that back up. Recover him again. Whether you do it in the ambulance before you get into the ambulance, that part doesn't matter. But he cannot stay on the board. Oh, gotcha. Just like that. Okay, so I will run these 3 over. I can find where that other one went.
That one doesn't have one.
Okay, we're missing one on that side. So that one goes over there, and then boom, we load into the ambulance. Now that we're inside the ambulance, there weren't any bystanders, there wasn't anybody else that we could get sample history or OPQRST. We can't get anything from him. You're not done. Keep going. Okay. Now we're in the ambulance, we're going to start transporting. Now these can come off for a second, and now we need to do a full secondary assessment, full head to toe, right? So now I'm going to start up here, and now I'm checking in much more detail, checking the orbits, the nasal bone, the maxilla, the mandible, take out the pen light, check the pupils, look inside the ears, behind the ears, both sides. I can't do the back of the neck anymore, but I can still look through the front of the collar, JVD, tracheal deviation, medical alert tags, take my scissors, cut and expose the whole chest. Again, take a look and see if there's anything new that has developed. I'm going to do this clavicle, then this one, then this shoulder, then together. Check the sternum, come down, check the chest. And again, I wait for him to bag, see if I've got equal expansion. Get my stethoscope back out again and see if there's been any changes in my lung sounds at all. Shirt is now gone. We'll reassess the abdomen again, either one hand on top of the other or put one hand away. Reassess the hips by pushing in again. Come back down the legs and either take these off or cut them. Get them completely off so these fully exposed just down to boxers. Come all the way down. Now the footwear would be off if they weren't already. Can you wiggle your toes? Can you push down? Can you pull up? Capillary refill, do a Babinski, pulse, pulse, no medical alert tag. This side here, coming down. Can you wiggle? Can you push? Can you pull? Cap refill, pulse, pulse, Babinski, medical alert, don't find any. Okay, come back up to the arms. Start here, all the way down. Pulse. Can you squeeze? Can you wiggle? Cap refill, pinch, see if we've got any dehydration, any medical alert tags. Take a look here, bleeding is still controlled, no other injuries. Can you wiggle? Can you squeeze? Cap refill. Shouldn't have a pulse, and the cap refill should be almost non-existent or delayed on this side. No medical alert tags. So I did not find any other injuries. I checked the pupils. I can't get any sample. I can't get any other additional OPQRST. But now what I can do is put these straps back on here. And then if I had a couple of blankets, I can put on either side here, and that's when your top straps, which we don't have any on this stretcher, top straps would come across here, hook into here, and that's what would hold those head blocks in place to keep the head stabilized. And now I'm going to finish out my secondary assessment by putting the blood pressure cuff on
and then getting the finger probe on. So I've already done some manual vitals. Now I'm going to follow up with a set of vitals from the actual monitor and then trend those and see what I have on scene versus what I've got here, plus the blood pressure, skin color, temperature, and appearance. Add that in there as well. And then my secondary assessment is done. Then I move to my reassessment. This is a highly critical patient, so I can call dispatch and tell them start a trauma team at the hospital so that way they're ready. I can call additional ALS, but I am ALS, but if I wasn't, I would have called for ALS for more assistance to come, because this particular person is going to need that. So you've got your intercept coming, you've got your trauma team started at the hospital, and now we're doing reassessment. I'm reassessing all of the interventions and stuff that I have done. So I start right at the head, and I kind of go right head to toe again. Bagging is good, it's not getting hard. I can see that the airway is still secure, still no JVD or tracheal deviation. Reassess the lung sounds, make sure that I still have clear lung sounds all the way around. Then I'm gonna reassess the bleeding control that we have done there. And then I'm just going to take a look, see if any new bleeding or bruising or any other DCAT BTLS has started. I'm going to reassess those vital signs every 5 minutes. We're going to keep him covered with a blanket for shock, and I'm going to apply the 12 lead on so we can get some kind of cardiac output, see what's going on electrical-wise with the heart, and make sure that that's all normal. It doesn't have, let's say, some sort of blunt trauma to the chest, and it doesn't have something going on there, like a pericardial tamponade or something. And then I'm also going to do a blood sugar and take his temperature as well, right? Because my patients that are trauma are usually hyperglycemic and hypothermic. So if I needed to, I could add some hot packs in there as well and see what that blood sugar is, but then keep monitoring every 5 minutes. And then you're done.